Here we go.
What's up, guys? How's it going?
Hey, Dr. Salcedo's here in the house.
Yeah, sorry about that little technical glitch, but I'm on now.
That's great. That's great. So here we're live in Phoenix right now, where we're having an
Awesome.
unusual cloudy day.
Oh,
We have
okay.
the
Okay.
waste management open, and we're very excited for this. When we met, we were at the Tiger Innovative Conference. It was
Mm-hmm.
very interesting. I really enjoyed the collaboration, and also, there's very few times where you see such a need and such a want in people, and the lack of awareness of good solutions. Probably because the environment was polluted with previous with previous solutions that didn't work and previous
Mm-hmm.
options that were suboptimal. So um, I wanted to just kind of work with you because I know how much inroads you've done and how you've been able to develop that market in California and allow people to know what their options are, to explain the high reward, low risk, low cost options that actually have a terrific effect on this problem of cellulite and how we can attack it and really help people that are concerned with this issue. So,
Absolutely. Yeah.
so I'm going to start. Dr. Salcedo, for anyone from our group that doesn't know, is a very well-known collaborator in California. He's very much involved in innovation and bringing new technologies to the market on the retail level. And he's had a lot of success. And some of his before and after photos that you see is quite exceptional. And what I like is it's not only done just for, you've also delved into the actual anatomy and physiology of how to perfect this, more than just doing
Yep.
this, the curiosity and how to expand this to more uses. So um, we'll start now, and I think you're going to start on the presentation and explain a little bit about, how you've gone about this and what you've learned over the past few
Yep.
years in bringing this to market.
Awesome. Yeah. Yeah, I'm
Yeah.
excited. This is very cool topic. It's great that you're having kind of this open house discussion about it. The Avéli and alloClae, the A square is, it just people are they want this, they're desiring this. And what's great for us is that you're not going to see a lot of lives about this. There's not a lot of people talking about it, which blows my mind that it's such a good, it's effective, it's something people want, and there's not more people jumping on it. I mean, like, that's great for us, and I'm glad for the patients
Yep.
who are here seeing it. It blows my mind, but it's great for us. It's a good opportunity for us to corner this area of the market, and I love that.
But yeah, and the market research that has been done has shown that the four major reasons why people aren't inquiring about it is: one, they don't think there's a solution; two, they're
Yep.
embarrassed; three, they think that there's a very poor reward to cost ratio, so that it'll be a lot of expense for very little gain; or four, they don't think it'll work. So this is a knowledge issue, it's an awareness issue, it's not an
Yep.
issue with the results of the technology and the procedures.
Not at all. Yeah, we're going to change that tonight. We're going to dispel all those myths, and those barriers to treatment are getting knocked down tonight.
So
So yeah, absolutely.
I think you're probably one of the largest volume people around this in the West Coast. I know that you've really gained a following in California. So I'm going to let you start the presentation and kind of
Sure.
explain how it goes. So here's our first slide. This is, can everyone see this properly? Let me
Yeah,
see.
I can see it well too. So thank you.
Okay. So what they talk about A squared, it's funny because the first patient I did alloClae on, and I believe it was the first patient in the Southwest. The first patient I did alloClae on from Tiger Biosciences, I knew nothing of what their plans was. And the first patient I said, this should go with the Avéli. Like, it was
Yep.
the first thing we used it because you needed a small volume, a small amount. She didn't want invasive stuff. She didn't want liposuction. She had a little bit of cellulite. She was complaining just a little bit of the shape of her buttock. And I was like, this has to go together. And when I called the company and I said I used it with a product Avéli, they're like, well, we just bought that company Avéli to put them
Yeah.
together for A square. I had no idea.
Yep. Yeah, I did the same. I was like super interested in alloClae, and I was trying to get in. I can't remember the name of the company that had it before. And then yeah, when they scooped it both up, it was like, oh, finally, this is awesome. This is going to
Finally.
work together really well. You have some questions too. Did you guys want to address the questions like during keep it kind of open like that, or you want to go through the presentation? Because people are asking, is it permanent?
Yeah, I mean, as you see questions, we just address them. We can address them as we go. This is a very informal talk, just like in a consultation. It'll go
Cool.
different directions, and people want to know things as they go.
Yeah, so we'll touch on that in the talk, but both, as far as I've seen, are permanent. So we've got 2 years plus results on patients who we've done Avéli on
Yep.
that still have excellent sustained results. alloClae, we don't have 2 years data, or at least I don't, but I have close to 9 months plus with sustained results with the alloClae as well. So yeah, I mean, for me, it's been as permanent as you can get at this point.
Yeah, and Dr. Cassandri's data, which is more long term, is very impressive, and
Mhm.
is very well done. Their market research and their clinical data is very well presented. There, it reacts. Obviously, not alloClae reacts very much like the fat that you would transfer in the deeper planes when you do BBL or a breast. It has very much the same reactivity, or so it appears.
Right. Yeah, I agree. I love it.
And
So
go
go
ahead.
ahead.
I was gonna say, like, in terms of like the permanence, I think what people don't understand is breaking fibrotic bands and then putting in a filler of fat has not started with this. This has been used even in hand surgery. They've
Hmm.
experimented with this with Dupuytren's contracture. This is not sci-fi. This is just a new application of something that we know physiologically tends to work.
Yep. Yeah, absolutely. Yeah, and it's a great combo. I would say, I don't know how it is in your practice, but I don't even hardly do Avéli alone anymore. It's
Yeah.
Avéli plus. It's Avéli plus alloClae. It's Avéli plus fat grafting. It's Avéli plus RF microneedling. It just, yeah, I mean, it's such an effective treatment. It works with all these different modalities that we have.
Yeah, the putting in the filler, the fat filler, is kind of closing the loop on it, right? You can
Hmm.
take away the offending agent or the offending bands, but then you want something there that increases permanence, and it just gives you a little bit of extra safety on that. Plus, it allows you to shape the volume the way you want. Once you release it, now you can see how you shape it, and it also allows you to expand that tissue to get the nice convexity that you want, the nice shape that you want, because you're no longer constricted. So it's the perfect time to
Hmm.
put in that little filler.
Yep. Yep. Exactly. So, what is cellulite? That's why everybody's here, right? So, what is it? And you've got a great slide. Hopefully, the people in the live can see that. So, yeah, there's a lot of misconceptions about what cellulite is and isn't. And I think you made a great point here. So, first of all, just think of it as bands, right? It's collagen. It's these fibrous bands that go from the skin to the deeper tissue. That's what holds it down. That's what gives the dimple. The biggest misconception is that people think, if I'm thin, I'm not going to have cellulite, right? What or what causes it? What causes cellulite? And if I don't know if people on the live can see it, but this is a super important point right here: is that the bands are influenced by genetics, hormones, and changes in skin quality. I think those are the three most important things. So weight doesn't matter, right? I mean, heavy people have them, thin people have them.
You People in their youth have them.
Genetics,
There are people who
people in their
in
youth.
their
Yep.
teens and early 20s that have them.
Yep. Yep. Yeah. I mean, you would have to think that it's at least to some degree, maybe all genetically determined. So I think genetics play a huge role. Hormones, I think, also play a role, and we see that in that kind of perimenopausal patient population where they start noticing it more, and then post BBL.
Yeah, and I think also people should know those bands. We all have laxity in certain zones in our areolar tissue that allows movement of the skin over our deeper structures. Those bands is what anchors things, so they're very useful, and they're all over the skin. And the cellulite happens when there's just a few bands that are with gravity. They're just puckering in the skin there, and now that you can target specifically those bands, you can still keep the functionality between the deep tissue and the superficial tissue, and just get rid of those specific areas that are causing the
Mm.
contour issues.
Yeah. Yeah. The targeted nature of Avéli is what makes it unique, right? That's kind of the elegant part of the Avéli device. I know, I think you have some slides later about Selfina and other
Yeah.
devices and Quo. And There are a few different ways to semi-effectively treat cellulite, but Avéli is by far the most directed, the least traumatic, and the most effective, honestly.
Yeah, for sure. So these are some signs. I know you've seen these because you've worked,
Hmm.
you've worked and presented on this a lot. And so these are some
Yeah.
of the stuff. I mean, the numbers are just astounding. There's 2/3 of women that have concern with dimpled cellulite. It is the number one body area concern, the number one area of concern that they would treat permanently if they could. The number one searched internet site over liposuction
Yep.
for things. And you
Especially in
know,
the summer. Yep.
especially in this, especially when those areas are more revealed. Exactly.
Yep. Yep.
So I'm gonna let you. I'm gonna let you talk. These are your videos.
Yeah, these are just a few treatment videos just so people get a taste of what it kind of looks like. We'll do some more, but essentially the device through a very small incision goes underneath the skin. We use this red LED light to localize where the dimple is that we've marked. We activate a hook and then we're able to cut the bands. And what you'll see is when I pull out, you're going to see some of that tissue actually on the device itself. So
Oh, look at
we don't
that.
do this every time, but yeah, we'll kind of wipe it there and you can see that tissue. You can see that we're extracting some of those bands that are causing the cellulite dimples. So it's like a um, real immediate and gratifying treatment. And
Yeah.
patients love to see that. I mean, they absolutely love it. When we go live on it, we show that, and people are like, "Oh my gosh, that's so amazing."
The other thing I
Same thing on
love
the
is that
second one.
again, yeah, you can look at that band right there.
Yeah, incredible.
The other thing that I really like about this is that you can go back with that hook and you can actually verify
Hmm.
that we're clear now. It's
Yep.
not just there and then okay, we'll wait a month and see if we need anything else. You can see in real time. You can verify that you completely got it.
Yeah, but that's what's important about going to a surgeon like yourself, because not everybody has that technique down to go back into gym or to understand. There's so many components. I won't go into it now, but that's why it's important to seek out someone like Dr. Tessler who has the experience with it. Because if you're not good at numbing,
Did we lose sound? Is he gone? No, I think we just lost sound for a second, and he's frozen.
sorry, did my audio go out?
It went out for a second, so maybe you
Okay,
can
sorry
just.
about that.
Oh no, no worries. Maybe just repeat exactly what you were saying.
Yeah, I was just saying that's why it's so important to go to a surgeon like yourself, like Dr. Tessler, someone who has experience with it, who knows how to numb the patient so that they can do a good treatment, verify that the bands have been cut, and understand how to do it properly so that you can get a good treatment. Because some people don't, they don't have the right technique, so they're not going to get the long lasting results, or they're not even going to get an adequate treatment. And that's really important because you said that yourself. You've got to go back and check, and you'd be surprised not everybody does that.
Oh, I mean, to me, that was probably it's what you're talking about precision. You have a precision tool.
Yeah.
You want to use it to its maximum.
Yep.
Um, I love these. I love some of these photos, some of these before and afters that you have. I mean, you can just see. I mean, you can talk about these yourself. I mean, this is your great work.
Yeah, I hope you guys can see those and appreciate it, because that's where it all comes together. When you see the before and afters and you see how nice those results are, it just speaks for itself. It changes the buttock shape. It gets rid of those dimples. And that patient, she got better over time. So that's another thing too. You get that collagen remodeling after you release the cellulite bands, and those dimples get better. They almost fill themselves in, maybe 10-15%.
And do you think that using either Viality, enhanced viability fat transfer, or alloClae, do you think that helps stimulate that good collagen in there too? I mean, it also has a regenerative effect in a sense.
Totally. I think especially with fat grafting, right? So with fat grafting, you're bringing in stem cells as well within that fat graft as well. So yeah, I think that's phenomenal. I don't do a lot of that, but I'm interested to hear you talk about that because I think it's a phenomenal idea.
Yeah, and I tell people, especially with fat grafting the face, we are in the infancy. People didn't realize that up until the 90s, we didn't know. We thought stem cells you can only get from the marrow. So
Hmm.
you're not going to get a spinal tap to get some stem cells. That's a pretty invasive procedure. It was only in the 90s really where we discovered adipose-derived stem cells and mesenchymal stem cells, and the explosion since then. I mean, over half of wet lab research in universities are really adipose cells. This is only in
Hmm.
30 years, so it's really expanding, and we don't know how much. When we talk about fat cell survival, the Viality papers coming out, we don't know how much of that is your own cells versus stimulation of the cells around it. We don't
Hmm.
have all that. We can only look at the volume and see how the volume is affected. So this is another look at that result.
Yeah, I mean, you can just see how it changes the shape of the buttocks. So it's almost, some people are like, it kind of looks like I got a BBL because it really reshapes those as well. And that is a solo treatment with just Avéli alone. I don't think I did any fat or anything else with it.
Yeah, and I think one of the things with the buttock is like people want that nice contour, and I think a lot of people even are inhibited because they're like, I don't want my buttock to get huge or anything like that, and they're really looking for shape. This is actually a tool that allows you to get shape without having to put in tremendous volume. You can keep your
Hmm.
volume and get the shape you want by allowing that envelope to mold properly.
Yeah, 100%.
This I love, and this is pretty nifty, especially with weight loss. As people like the thighs are, this, the thighs are a huge challenge, right?
Yeah.
It's a weird convexity, it has different points of adherence. Historically, it was just for massive weight loss people. Now you have new populations of active people in their 50s, 60s, even 70s that they'll want to get that tighter contour. And as the gravity comes down or there's weight loss, you have those bands that are restricting it, and that bothers them more than the size of the leg. Like the majority of people that are coming for their thighs, it's the actual contour and not they don't care about reducing it. They want it to be more smooth.
Yep. Yeah, and that was actually a scar. So that was a scar from a reconstructive procedure,
Yeah.
and we released that scar with Avéli. I lipo to blow it, used Viality, and then re-injected that fat underneath the scar. And she's got sustained results that are just fantastic. And she feels like she can actually walk better after this procedure because
Yeah,
she had cerebral palsy. That's where she got the scarring from.
look at the difference in the contour. Just the release on it. It's like a. This is it's a different person. That's great. So why don't you
And
talk
this
about
just
just a
kind
little
of
bit of
commenting,
anatomy here?
yeah, because we see a lot of women that have that tightness in that medial gluteal area. And a lot of people with lipo, they'll take the cannula and scrape it and try to weaken that ischiocutaneous ligament. But it's perfect for doing Avéli to just release the tissues off of it. And you just get the tissue to kind of relax and settle into a roundish in that medial gluteal area. And that alone, even if you weren't treating dimples, it makes a lot of my patients extremely happy to have that better contour immediately.
Well, I think anyone that does BBL, I think that big challenge is that big, elephant where you're trying to put in volume, and instead of it getting round, it
Hmm.
just gets taut, and it's almost
Yep.
flattens, and you're like, ugh. And the reason
Yep.
is because you're not releasing properly the ligaments. You can try to weaken it, but
Hmm.
if you release just those specific ligaments, it's it the envelope now can shape the way it wants to shape. It's not inhibited. I think most of those times it's because of these bands, because of this ischiocutaneous ligament, and it just, instead of getting nice and round, it gets tight, and people try to compensate by putting extra volume in, which causes sometimes fat necrosis. It's not the right solution.
Yep. Exactly. Exactly. And you combine this with like a BBL, fat grafting, all that, it's perfect.
Uh,
It's something we weren't able to do before effectively.
look at that result. This area here is known as, some of the hardest areas. Even with BBLs, you can see their anterior posterior has a nice thing. Even sometimes their hip has a nice thing. But this tends to remain with it. And this is also the scary area where historically people were worried to put fat in, right? Because they would
Hmm.
go and they'd go deep, and that was the vascular plexus in that area. And
Yep.
really, what you needed to do was just release those bands, and all the deep compartments, they're all connected. If you just put in the deep compartment here and this is released, it'll open that up.
Exactly.
You,
Yeah.
you,
There's no grafting there. That's literally just release.
that's
So,
unbelievable. Yeah. This is
and
your.
then, this is just for Viality. I think you're going to talk about that a little bit more. You
Mhm.
you cannot beat the fat that you get with Viality. You just cannot beat it. That is pure yellow, thick, beautiful fat that
Yeah.
is amazing for grafting.
it's funny because people think that the surfactant that's used there, they think it's sci-fi and everything. I'm like, we use this on babies. Like that's we
Yeah.
use on premature babies. And it's funny because it's essentially a soap. And
Hmm.
once you wash it with soap, you're like, why wouldn't you wash it with soap? It sounds obvious
Right.
now, but like I know it wasn't obvious, and until like some people who dabbled in transplants started looking at fat grafting and saying, this is actually an auto transplant. We're not treating this biologically like a transplant. We're treating it almost like an implant. You should treat it like a transplant,
Hmm.
is when this came out. And I don't know if you've seen the paper that's going to come out, the 80% plus retention, which is unheard of. And I
Yeah.
don't think people understand that the 80% retention is great from a volume perspective with this, but it's not just that. You're putting less necrotic burden in the patient, right? You're putting less volume. There's less
Hmm.
unpredictability with the viality. It's not just the retention rate; it's the predictability.
Yeah. Did you present that? Were you presenting on the viality?
In where at the Tiger meeting?
Yeah. Yeah. Yeah.
Yeah, I was presenting a little bit on the data that we had on the paper.
Yeah,
You know,
I thought that was phenomenal. I mean, I already loved it, but when I heard all that, I was like, okay, it makes sense. I didn't realize it was so much the surfactant that was the key there.
because they're not
Because
allowed to
there was
talk about it.
sometimes,
They're not allowed to talk
yeah,
about it.
there was sometimes I wasn't even using it, and like since then, it's like, oh, what was I doing? And now, sometimes I don't even use the Viality machine. I just use
Exactly.
the surfactant.
Exactly.
Yeah.
It was they weren't allowed to talk about it by the FDA approval rate. And I remember when Sientra used to have it, I'm like, well, you can explain to people why it's working because they thought it was just the machine that you presented. And I'm like, no, it's not just the machine, right? It's the fact that you're repairing the cell membranes, you're putting a soap in, so it's kicking out the fat, the water, and the blood, right? It's increasing the
Hmm.
purity and the quality of what you're putting in. And I was lucky because I remember the original wet lab data. They did it with mice models, and it's uncanny. Very few times do you have an animal model and then a human model, and the numbers are almost identical, right? Because they would use nude mice and they
Yeah.
put fat in the back. And I was at Mass General when they were doing this paper, and so I remember I remember the white paper before Viality came out. I had no money, but I wish I could have invested in it back then
Yeah.
because we knew it worked, right? It just took
Yeah.
time. So they never spoke about the surfactant because it wasn't a drug approval. So it has to be sold as one. And it's funny because P188 is such a common surfactant but you're not allowed to buy it separately. You're not allowed. I mean, that's the way the FDA does it because there's manufacturing controls. They have to make sure it's safety. But really, the magic is, the machine, the Viality machine is very good. It's as good as any other machine. But really, the magic is in that surfactant.
Yeah. I love it. You kind of.
We're getting we're going mute again.
Oh, sorry. No, I was going to say you kind of like blew my mind with that. It changed my whole perspective on that fat grafting part. So I appreciated that. Now, a couple of people are asking questions.
Go ahead.
So are you taking questions? I would say, yeah, right. We're taking
Yeah,
questions if you have a
sure.
question. And then I think you're taking over here. I know I have like a little mute and stuff going on. So I'll kind of drop off the live if there aren't any questions on my part of the Avéli part.
Okay. Well, do I see the questions? Where do I see the questions?
So as Linnea, Arizona
Yeah.
had a question. Let's see if she's still on.
It's linear, Linnea.
They may have, yeah, they might have dropped off.
Oh, how permanent is the treatment? Well, the treatment should be permanent. The treatment should be. There's no listen. The aging process continues. There's going to be changes in your body as you go. And when someone asks how permanent something is, I try to say it's forever and for never, right? Like the treatment, it's like going to the gym. You never lose the advantage if you do a good month and a good program at the gym. You never lose that advantage. But if you stop going, things will develop again. So you never stop aging, but it takes where you are, it elevates you to a place that you're happier with. And then you have to take care of yourself the way it is. And if you need something in the future, you need something in the future. But the bands that you're affecting now, the treatment that you're doing now should be permanent. But like everything else in your body will not you can never freeze your body at one moment in time and expect there to be no changes. There's no permanence in that. We're a
Yep.
dynamic species, you know? Okay, so this is A2. This is, I really like
about weight or lifestyle. It's structural.
the way they show this.
Cellulite
This is a very good way, as you know.
bands under the skin, called septae, tighten and pull
Good
downward,
little AI,
while
right?
fat cells push upward, causing that uneven, dimpled. Oops.
How did we go? Sorry.
Did you guys make that animation with AI, you said?
Yeah.
80% of women
Yeah, it's
experience
great.
cellulite. It's not about weight or
So
lifestyle.
our superstar Marley made this.
Cellulite forms when fibrous
I
bands
love
under
it.
the skin, called septae, tighten and pull downward, while fat cells push upward, causing that uneven, dimpled texture. In the past, there has been no reliable treatment for cellulite. There have been many
Remember Silo Shirt?
technologies introduced as a solution,
Yeah,
but none that
cool.
have been able to address the issue permanently. At Define, we target the root cause with a superscript 2, a powerful two-step treatment combining Avéli and alloClae. Step 1, using the Avéli, your surgeon is able to precisely locate and release those
I
fibrous
love that.
bands, instantly smoothing the surface. Step 2, using alloClae, a next-generation structural adipose filler, your surgeon will fill and reinforce the area where the bands were released, stimulating collagen, restoring volume, and helping prevent those bands from reforming.
That's exactly what you were talking about.
The
Mhm.
result? Naturally smoother, firmer skin, without surgery, synthetic fillers, or downtime.
And just to say, did you ever use Sulfita? Because I know that you're pretty advanced with this. One of my old partners did it. The problem with Sulfita is, you see, it's just a blade here. You can't have that precision. You're kind of guessing. And what people don't understand is they took this off the market. Sulfina is no longer on the market. Some people still market it because they
Right.
still have some devices, but they took it off. And just to give the difference, not only is Tiger investing and fully invested in Avéli and alloClae, but they're even coming up with next generations and improvements to help, not to make it more effective, but to help users like other doctors and surgeons who are not as comfortable to have more ease, especially with like freezing and numbing. I think for you that you're already past that and you have that expertise, but really to get this democratized to the population as a whole, we need an army of surgeons who are able to do it. We want other doctors to be doing this. We want other surgeons to be doing this. Yeah, we're not trying to compete with anyone. We're trying to present it so that they can adopt it as well. And the easier it is, the better it is. This is an article by Allure where the author herself, she was intrigued. So in the process of writing the article, she did it. She went to a doctor to do it, and she wrote about it. And this is her before and afters. So instead of just talking about this new cellulite treatment, she talked about her experience with the cellulite. It almost became like a patient testimonial in the magazine.
Yeah, and that's a great result too. She's probably thrilled.
She's thrilled. So you know about this. This is a little bit of a preview. I know it's not released, but this is the alite. This is special. It makes it more comfortable for patients.
Yeah.
Obviously for you have the expertise. This is not such a big deal for you, but for the population as a whole, for the medical field as a whole, this is going to help a lot.
It will. Yeah, it will make it accessible to more practitioners for sure.
I think so.
We do have some questions.
Okay, let's get some questions. Do you want to answer some questions, Dr. Salcedo?
Totally. Yeah, let's do it.
So one of these questions is talking about what the recovery is like.
What is the recovery like? That's one of the questions.
Super common question. So for us, our recovery, there's no general anesthesia. So patients, it's local anesthesia. They come into the office, they get the procedure done. We actually don't even suture up the holes because they're so small where we do Avéli. And if you're doing alloClae at the same time, I'll let you comment on what you do for your A squares. But for just Avéli alone, we don't even close it up. They'll go home the same day. They can sit on their butt the same day. We just ask them to wear some Spanx, like a light compression, and go for light activity for about a week. That's it.
So what is it, there's a lot of, we get a lot of this from patients. I'm going to ask you how you address this. A lot of patients have a bit of a misunderstanding in terms of sitting and all these things that they can and cannot do. They don't
Hmm.
understand where the pressure points are, what it is, and they don't understand that within 48 hours, the body either keeps it, or even if you don't see it only survives by diffusion for 2 to 3 days, and then blood supply. That's how quick it is. So
Yeah.
you don't want them jumping and bouncing on their bump, but the whole point where they think they have to sleep, hanging upside down. It's like, it's not like, a lot of that is
Yeah.
old school, like magic.
Yeah, it is. But my thought on it is like this: if I give the patient an inch, they'll take a mile. So I try to rein them back, because if I told them what we know, which is like, yes, it's okay, you can sit on your butt, you're not going to kill all your fat graft, then they'll just do it way too much. So I try
Yeah,
to rein them back just a little bit, and
just to make
have
them aware.
them be cautious with it. Exactly.
Now, what do you prefer alloClae or EVFT or Viality and fat grafting surfactant with this, or does it depend on the volume you're using?
It depends on the volume, and it's good that this is us doing it. It's not like Tiger sponsored.
Yeah,
I love fat grafting. I just think fat grafting is great because you get so much benefit from it. There's always some area that a patient wants to have lipo. So you get to knock that out. Number two, use something that's native to their body. It's natural, if you will. Okay. I mean, alloClae is allogenic. You can go into that if you want later, but the point being, it's your own tissue. What survives is permanent. So for me, my go-to is always fat grafting first.
it's funny because you know, you did your boards, you're board certified, you did all your in-service exams, you were tested for decades and
Yep.
decades. Like, it probably felt, I still sometimes wake up thinking I have a test coming up, and then I wake up, I'm like, oh, I'm done tests. But,
Yep.
so we all went through this, and, in all of our learning from day one of residency till, our continuing medical education, they talk about the criteria for the best prosthetic, right? Because in plastics, you have
Mm,
to, and all the criteria for the breast prosthetic is like, there's 10 criteria, and all of it is designed to mimic as much as it can you, right?
yeah.
If we have you, that's the best prosthetic.
Yep.
That's is by definition. We've all answered that in exams. That's how we get certified.
100%. Yep.
So
Replace like with like is what we always say too.
exactly, exactly. For alloClae, have you used it a lot? Breast, buttocks, hip dips. What's the
Yeah,
major areas?
I love it for breast. I've used it in a couple like kind of large volume, 100 cc's. I've got the buttocks where I struggle is 100 cc's, in my opinion, is just not enough. Okay. And I've done 100 cc's a couple times in the butt. I have thankfully one that's coming up that's 200 cc's, and I really feel like 100's the floor in the butt. Anything less than that, it's so hard. You'll see a difference, but it's really hard to
It's not
feel
gonna get
like you
full
made a
expansion.
big difference. Yeah, you're just not. It's too much volume. But in the breast, 100 cc's is great.
I mean, the price of alloClae has already come down 15%. I think, people have to realize that they have to go through a lot of quality management. They can't just,
Hmm.
they have to do a lot of processing, and it's going to take them a while to ramp up the supply. I
Yep.
agree with you. I haven't done a lot for bums. I've done for hip dips, because I think that for the lateral portion of the hip dip, 100 can do a good job if you release. Again, you can use Avéli to release those bands that go laterally, that brings it in, that flattens it out. And then if you get it in the deep tissue, 100 cc's can make a nice, convex contour of the lateral. But for just an overall BBL, I think it's difficult. 100 cc's in the breast actually goes a really nice way because it has more
It
form
does.
stability. It's drier, right? So you're actually getting
Hmm.
close to a size, right? You're getting
Yeah.
close to a size. In 5 minutes, you come in, nothing, no downtime. You just get a size bigger, and it's and,
Yep.
and it's all you. It's soft. I think it's wonderful for all that.
But
Uh,
here, this is for everybody listening, though. Once it's like Pringles. Once you pop, you can't stop.
mhm.
Just about every patient we've treated has wanted more.
Yeah,
And I don't know if you've seen that, but yeah, it's
yeah. I have
fantastic.
one
But just,
coming next week.
yeah,
She
just be
she didn't even
prepared. You're
bother
going
to
to
call.
want
She just
more.
scheduled. Yeah,
Yep. Yep.
but
They all
but
want
we
more.
we tell them also, we tell them go, because there's no downtime. And that was one of the questions. Because there's no downtime, there's no harm in going by steps. First of all, you get to
Right.
now, you get to customize your look with a different exactness, right? You can go 50 Cs and do it 2 or 3 times, and you can say no mas when you're ready to go. Like you're taking the guessing out of it. It's very empowering for the patient. They can really control the shape and the size that they want.
Yep, exactly. It's very customizable, which is awesome. Off the
This is
shelf.
when we were at that meeting. This was the patient. I remember, like at the end, and you're all talking about. You're like, "Why'd you talk about this?" Because I gave it to the company, the pictures, and I was like, "Oh, I think that's mine." This is
Yeah.
the first
Yeah.
patient we ever used it on, and this was her before and after. I mean, just to show, we put in 25 cc's of alloClae. We used Avéli. That's all we did, and look at the difference in the way her underwear is indenting in the buttock.
Yeah.
Like, look at
That's
that shape
awesome.
difference.
Yeah.
She's been a great advocate for it, and she's really been trying to like get it out there. Obviously, she doesn't want to go from the mountaintop and scream that she had this done, but she's been terrific. Um, yeah, this is the EVFT. We just actually the paper PRS just wanted a few modifications, like grammar stuff, and it's being resent in the beginning of February. I'm super excited for the paper. I think this is going to be a landmark paper. Like when you're in residency, they say, what's like your Class A papers, which change your practice? What's Class B that you think about? What's Class C that you don't care? Class C you'll never
Yep.
do. Like uh,
Yep. Yep.
this is going to be a Class A paper. This is going to be, I think, landmark because no matter what anyone says, and I don't think anyone intentionally says not the truth. I think everyone is honest at heart, but there's recall bias. And so when you hear
Mhm.
people say, I just do fat grafting, I get 60%, I'm like, no, you don't. Like,
No.
and that's not me saying it. If you did, then you are different than every company that's ever tried and every doctor that's ever tried. There's some magic there that has not been verified in the literature. So when people think that there was one thing that increased fat grafting, it was, remember the Brava?
Yep.
It was like these
Yep.
huge cups on the breast.
Yep.
And Corey did it out of Miami, and you had to like
Yeah.
literally have your breast for 10 hours a day. It was
Yep.
high pressure sucking on
Yep.
your breast for 10
Yeah.
hours a day. The compliance was 0%, right? And,
Yeah.
a few patients were able to get through it, and it helped. But outside of that, nothing has shown a significant difference, right? It's all 20 to 50%. And then you use the surfactant in the mice, and you see it was at 90%. I mean, it was a shocking difference. And then you use it with a Viality, and it's over 80%. And at 1 month, it has almost, there's no statistical difference between the 3D volume at 1 month and at 1 year. So you're seeing it right away.
Yeah. That's amazing.
It was 14 clinics. It was prospective. I think we did almost 100 patients here. It was wild. It was unbelievable. Like the results were unbelievable. And the amazing thing about the EVFT, I have not had in 5 years. I have not had one patient come to me and say there's a question on a mammogram. I actually wanted to do with imaging people. I wanted to do a prospective trial
Okay.
because
Okay.
there has not been one artifact that even they'd get nervous. It's like, oh my God, do I have it? Because they'd call you, right?
Right.
If they see a calcification, they could be fat grafting, it could be a breast cancer. Your patient's going to call you. We have had zero, and at least over 250 patients we've done. Zero.
So you need to highlight that because I don't know if the audience understands like how significant that is. That is a huge deal because that
Huge.
is anxiety, right? That's patients who get a read on their mammogram that says, "Hey, we don't think this is cancer, but it could be. We need to rule it out."
It
Can you
happened
imagine
to
the anxiety?
it happened to a good friend of mine, and she's like, she's just for a week, and I told her, I was like, it's an artifact. I think it's an
Yeah.
artifact, but it didn't matter. Like she didn't sleep for a week, and
Right.
she will never go through that experience again. And then I'm out with
Yep.
them, and she's like, never do fat grafting. It's horrible. I'm like, no, 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 no. Like there's different kinds, right? But yeah, so we had an imaging company. We've been trying to organize studies for this, and I was like, well, if you are getting zero, You know, mammographers should be good enough to tell the difference between a calcification, but calcification happens from necrotic tissue. What
Yeah.
people don't understand is when you have cancer, the cancer grows a lot, some cells die, it gets calcified, and so they have to sometimes rule that out. And you can get calcifications when you put cells in and they die and they don't get chewed up, and you have a few cells in there. But if you have very little necrotic tissue, you're not going to get those calcifications. So I can't say for sure because I haven't done the trial or the study, but I can say that in 5 years I haven't had a single question, and I've done it in mastectomy, post mastectomy recon patients. Right? Nothing. No, people were getting, they're already anxious and they're getting checked like extra carefully by everyone. Nothing. We've had nothing. 5 years.
Yeah. That's amazing. I mean, that's extremely commendable.
So we're happy. So you were talking about the yellow. This is what I showed.
Yeah.
So this is what I did. I didn't use the Viality. I just used the surfactant. This wasn't going into a patient. So is a Williams-Sonoma colander. Basically the same thing. It's a mesh. You're getting rid of the fluid, right? And I just show kind of the difference. People often ask what exactly is enhanced viability fat transfer that we use in many of our procedures. This is after it was decanted for like an hour. Right, to try to purify it, washing it 3 times and letting it decant. Previously treated fat using decanting and wash. We can see here how the Polaxmer 188 purifies and increases the health of the fat. So that's a telfa to stimulate methods of purification. Look at the difference. Same fat.
Yeah.
You can see the difference in color and consistency between the 2 different treatment methods here. And that's after traditional, like that's not non-treated fat, that's traditional fat. I mean, the difference is remarkable. This is what you're putting into your body.
After your lecture, I couldn't go back. Like I couldn't unsee it.
Yeah. And these are, I mean, I saw your pictures. You've done this, you've seen this, These are sometimes because of the body type. Sometimes these are difficult patients to actually get that contour. And, people have to understand also, like different bodies have different results. It's harder to get, a really great result on, the easiest patient is a patient who's 90% there on their own.
Yeah.
Right. Like it's what people don't understand. The harder thing is when you're starting something and you're kind of kick-starting them on their journey. Right. So this patient afterwards continued to lose a lot of weight and she's doing great. I mean, and she's done most of the work. She just needed that boost,
Mm-hmm.
So who's a candidate? 67% of the female population. 66% said they have it. 66% are candidates. There's no medical contraindications to this. It is, I can't think, bruising? I don't know. Is that the major, like, is there any medical complications you can, I guess you can get infection. I've never had one.
I've had one cellulitis. But I've done hundreds, which if you think about procedures in general, that's a pretty low number. I mean, that's a crazy low number.
Yeah, it's almost like an arbitrage free lunch situation. You're getting reward. It's very unusual that you get reward with very little risk. Like that's a very unusual situation. So I think almost everyone is a candidate that has cellulitis. I guess if you don't have cellulite and you want a cellulite treatment, you're not a candidate. But besides that,
Yeah.
And I think once again you're very eloquent and very explanatory in your opinions and experiences. I thank you.
Well, it's fun. I mean, it's fun sharing amongst 2 experts, on these types of treatments that are exciting. They're proven but new and not utilized enough. So it's a lot of fun to talk about it.
I also really love this kind of collaboration. That meeting was one of the most fun meetings I've ever had. I did not expect it because normally you get in there and there's, is this person says that and that person says that and everyone's marketing. And you could see in the first 2 hours, it was kind of like that. Everyone was on guard and then it just stopped. And then just people started because it's people that share the same passion. And then you just realize our job, we're not trying to be the leaders. We're trying to develop awareness in the market. We'll do fine regardless. We just want everyone to do it. We know that this is something that is going to benefit the population. It's something that has a good reward. It is something that is to their benefit. And so I love these kind of collaborations. It's just people who are not trying to market to get market share. They're not trying to market to get patients. They're just trying to work together, almost like, back in the university, like when we were all young and had that, people don't
Yeah.
realize everyone started doing it. They wanted to change things. No one goes through all that pain if they don't have a passion for it.
Well, that's why I'm here on the live, because I miss that camaraderie. I miss that less competition and more collaboration. It's just more fun.
More fun. We're going to bring it back.
Yeah. Yeah. Yeah, we are. I love it. Any questions on anything for on either of our audiences? Let's see. That'll be the time, huh?
We have a question here. What's the difference between Selfina and Avéli?
What's the difference between Selfina and
Ooh.
Avéli? We touched upon that. Why don't you? First
Yeah.
of all,
So
Sam, can you tell everyone approximately how many of these cellulite cases you've done, just so that they can get an idea of how advanced you are, how much expertise you have relative to other people? I think you're probably one of the highest volume people in the country at this point.
Yeah, I mean, there was a time that we would do sometimes 3 on a Friday. We'd do like 3 a week. So if I was estimating, it wasn't always like that, but I mean, I would say we're 200 plus, maybe 250, of these procedures. Which, yeah, I mean, that's big numbers for Avéli,
Yeah,
and
it's,
we've
it's, it's
gotten
like
to the point. Go ahead.
yeah, that's like a Harvard case. When we would do a breast recon, 250 is a big number. You can get
Yeah.
published on that. That's
Yeah.
that's a department, right?
Yeah, yeah, yeah. Hopefully, we will do some publishing. That's another thing too. With your paper and everything, there's not a lot out about this yet. So, I mean, we definitely should put some more data out. But I never really got to use Selfina. I was intrigued by the idea that the principle made sense. It's kind of like the less elegant version of Avéli. So, I don't have experience with Selfina.
Is it was did you start doing this with Avéli? Like Avéli was where you like Avéli
That's where I
got
started.
it piqued your curiosity, kind of.
Yes, yes. That's where I started with cellulite treatment. I was probably this close to exploring getting a selfie in a device and like looking into it, talking to people. But then I held off, and then Avéli came out, and I was like, well, this makes all the sense.
Yeah,
Like it has the same principle as Selfina without some of the downfalls.
yeah. I would say. I mean, and I don't know if you agree. Avéli is a much more precise, much more elegant evolution of Selfina. Enough
100%.
to the point that MERS saw this and discontinued it, even though it
Yeah.
was popular. They stopped it
Yeah.
right away.
Yeah. They just packed up. They said, all right, we got beat at our own game. We're done.
Yeah,
Yeah.
yeah,
Yeah.
that's wonderful. Any other questions for Sam or?
I have two more. How long does the procedure take?
Very good question. That is completely practitioner dependent. So I know Dr. Tessler or myself, we could probably knock one out in 45 minutes, depending on
Yeah,
how many dimples or less. When you have mid levels, depending on how well they're trained, it could be a little bit longer. But I would say if you're in one of our hands, 45 minutes to an hour. If it's a larger case, might go a little bit more than an hour. And
and
if you're going,
a lot of that is just getting the patient comfortable.
yeah, numbing is 30 to 40% of the complete overall procedure. The actual procedure, yeah, 15, 20 minutes to actually do that part of it.
Our last question
Yeah.
is how long would you say that bruising and swelling lasts?
I don't get a lot of bruising.
I don't either. I use TXA in my tumescent.
Yeah,
So I use
it's changed
tumescent.
the game.
Yep. I
TXA,
use
like,
TXA.
I mean,
Go
I
ahead.
still get bruising sometimes from lipo, but with fat grafting or this, I don't know. And if it is, it goes away pretty quick. It's not
Mhm.
like I don't get like a big purple buttock or anything like that. I haven't seen that in years.
Yeah, I mean, it's targeted. It's not like Quo. for the kind of the old school, also off the market, which was something that just kind of dissolved collagen. That caused tons of bruising. The
Yeah,
staining was permanent. Actually, the staining was
really.
permanent. I have a patient, yeah, and I haven't seen any hemosiderin staining in my Avéli patients actually at all.
Yeah, it's not even. Maybe I should talk about it more. It's almost, we don't even really talk about it that much because it's almost a non-issue, right? Like,
Yeah, yeah, it's like not a thing anymore.
That was our last question.
that was our last question. That's
That was
great.
it. Okay,
I love it.
awesome.
Thank you so much for joining us. This is wonderful.
Answered, learned a lot of things, and yeah, just fun first step on the collaboration front.
First step.
Yeah.
Excellent.
All right, guys. Well, thank you for having me. Thank you to the audience, and yeah, have a wonderful night.
Thanks everyone for checking in. Yep. Hope you learned something.